Yes, you finish and then I'll come, then I'll wrap with these three.
Okay.
Yeah, go ahead.
So I'm Augustina Kodua, and I'm representing the Pharmaceutical Society of Ghana. I have 2 comments and a question. So just to say that the Pharmaceutical Society is also prepared and willing to support with the communication team. And then there was a question on the hand sanitizers. So currently, the Pharmaceutical Society with the local manufacturers are working hard to ensure that we are able to restock pharmacies and also chemical sellers shop with hand sanitizers. So hopefully we'll get them back. My question goes to what happens when we hit this community spread. We have a lot of community pharmacies and chemical sellers. What are our preparations towards engaging the pharmacies or the pharmaceutical support staff in these pharmacies and community pharmacy? How are we going to engage them?
On their own protection, you mean?
Yes, and the people will come to them because the pharmacy is the first point of call. People may go straight in and may have the symptoms. What will be the criteria or procedures that they have to go through?
Yeah. Okay. Dr. Sarkodie will handle that one. Let me hear from this lady, then I'll come to the 3 gentlemen here. David, let's hear from this lady, then I'll wrap up with the 3 gentlemen here.
Okay, so I'm Clara, GTV. From Dr. Sarkodie's submission, he mentioned that some of the cases were confirmed outside Accra. So I want to know whether the regional hospitals have been well equipped to do the testing aside Noguchi Memorial Hospital.
I think as been said, I won't even let that go. As has been said, there are 2 places for testing. They may pick the samples, but 2 places for testing, Kumasi and Accra. So whoever picks a sample anywhere goes to either of these 2.
Please, how about the hotel? Do we have any measures put in place to ensure that foreigners don't import any of those cases in there?
Okay, thank you. I'll deal with that one later. 1-3. Risk communication has been doing a lot of work with the various stakeholders, including hotels, school, and everything. Dr. Da Costa, please rise. This is Dr. Da Costa himself and his team have been doing a lot of engagements. They've already met faith-based organizations and some of these groups, and so they're engaging them on what to do. But data is also being published on the website, as I just gave out. So we encourage these groups to pick up from that website, and you, the media, also pick up from that website. The last 3 from the side, sir.
My name is Zadok. According to Dr. Sarkodie, those who have been treated in relation to the confirmed cases,
yes.
If you saw the figures together, they are getting to over 200 or so.
Yeah.
I want to find out if these people have been quarantined. And then secondly, our borders, again, do we have any collaboration with our neighboring countries, Burkina, Togo, in terms of check-in entry? Okay, and if somebody also refuses to do self-quarantine, do we have measures to check such people? Because tracing people will be a little bit difficult in our country. Thank you.
The final 2 questions. He's asked, okay, so then we'll take the final one. It was the same question. Then let me quickly pick off those and then I'll invite colleagues. The Honorable Henry Kote is here, Deputy Minister for National Security. It is because earlier at this morning's meeting, on the enforcement of self-quarantine, the state security apparatus and the health authorities will be working to ensure that that enforcement takes place. You know that in every district in this country, there are security assets that can help us do that surveillance and tracing. So they will be doing that. They are also supporting our borders to ensure that there is enforcement, particularly of the travel advisory, as has been issued from this afternoon. We are collaborating with our neighboring countries. I was in the meeting when our health minister and foreign affairs minister were contacting the health ministers of our neighboring countries to examine the protocols being put in place and how possibly to standardize them. So we continue to engage with them in that regard. I'll take, I think, about 3 and then I'll hand over. One has got to do with the 100 million update. As I mentioned, all of these things are subject to review. This afternoon there's a meeting of the Interministerial Committee. I think it started about 10 minutes ago. If there's a need to review that, it will be announced subsequently. As part of the risk communication and social mobilization work, they're also engaging transport owners and bus terminals to ensure how they also advise their patrons to comply. Provisions for fiscally impaired in the public education access, Mr. Reko and the team from the Information Services Department, as they get out around, will ensure that that happens. And on the sanitizers, I think I mentioned some of the meetings that are underway. So I yield the podium to my colleagues.
Thank you very much. The cases confirmed, the various contacts, are they being quarantined? Indeed, yes. There are two forms of quarantine. That mandatory, where the state will keep you and take care of you, all your needs, and then ensure that within the 14 days incubation period maximum, you will be full up. But we, for now, as a country, have opted for the self-quarantine. We consider people to be responsible. We have the responsibility to protect our family, our loved ones, so that should you be a contact and the advice comes to you, stay at home, protect your loved ones, protect your family. Should it become necessary that we need to support, you provide needed support. Every day, morning and evening, somebody will go touch people, find out whether they are having any signs and symptoms, and then also ensure that you don't lose them to follow up. So we are keeping close watch on them, and then every day you provide them with the needed support. You give them advice, counseling, including psychological counseling, so that they would feel much secured and also support and ensure that they stay that distance from other people. If anybody deviates and doesn't adhere to this, then you would enforce the self-quarantine. The guidelines are there, and you use this. And then the regional hospitals, whether they are equipped to do tests. For now, I think it came out that we are using KCCR and Neguchi to do this test. The type of test we need to do, for now, I think the emphasis is on the 2 centers. We don't feel threatened to be overwhelmed. However, we still have put in measures to expand, and should it be necessary, country can spread out. We have second option, which other facilities have the potential capacity to be made to provide support. But now we don't do these tests within the regions. The issue on pharmaceutical societies, I think those were information. Students in schools, what are the various involvements? You take that, yes. We have started the mechanism working with the Ghana Education Service. On Friday and even earlier, there have been engagement with the 2 sites, Director General Ghana Health Service, the Director General Ghana Education Service. We have formally written to them. We have come out with a common communique, what we need to do together as various sectors. We have supported them to prepare a guideline using the SHEP in the School Health Education Program. And we have prepared a common guideline adapted from WHO, UNICEF, and shared with them, and they are using to let the various students and pupils appreciate what the do's and don'ts, the signs and symptoms, and their contribution in them. So this has been done. And also a guideline for teachers, so that they would be better informed to provide the needed support for the various students and the pupils. The border areas, whether we are prepared. Indeed, we admitted that our capacity mostly limits at the strength, the best of capacity as the various designated point of entry. 14 of them, we have more than that. The regular points of entry come more than 40. There are some areas that the capacity is not optimal. We have taken steps working with other agencies, getting more clearance to enable us from the finance ministry to enable us recruit more staff and deploy them to the various points of entry. We've also initiated process to train staff from disease control, nurses, doctors, and health staff, shift their task for them to do points of entry work and let them go and support the various tasks at the various points of entry. Yes, we admit that the numerosity of the various points of entry, our capacity in the areas is not optimal, but then we are in the process, the non-official, these are the areas that we have problems. We admit there are challenges. We need to work with other partners including the national security, including the other security apparatus within the country, immigration, SEPs, and then the local government to strengthen these borders. I think MFM eka say ye momode na ye monotofa enema na ya kan bi the meka no makwan na men kan twi on the 12th of March bosumi mu na ye already bosumi atoso miensa no mu da atoso dumienu na joint press brief ministries of health and ministries of information shared to just say COVID-19 pandemic Ghana yenya 2 cases only to dwa ama mo kaka ho enema asese ye eno na chi no ye de enema egu akwana surveillance ye de ani di ya na chi ye hwe ni ye enene nansa enenra enansa yenya cases mienu enra nso mienu okana bomu Ghana ya confirm cases eye insia and ni nyina no efri amanone na bewura ye mayimu ebra omo ba mayimu no na omo ni signs and symptoms omo bewura mu no ekire no na eded signs and symptoms na bibia na edi ewo omo na mu omo won sanchani bia wo nipadua no mu se omo yare ni bi bewura hunam ye mayimu no omo ehya ebinom hyase enya ensakire ewo omo hunam dua no no omo eko clinic no ye hu se betumi ayare ni bia ye fa sample ye de call lab e ma lab no confirm se bia nti se sia de be ka adwa e be si nra ye wie enra no ansa na e be wura ene dua yi mu no na cases ye confirm se positive COVID cases e wo Ghana no ye nsia ye de enema bi atudwa se yenhwe yehu ye wo enema ebetimi ande yare no asane edi no yenhwe ebra obi eben wo no ye anamo be mienu anami be mienu na yentwe ho enfo sebe ya obi wo yare no bia onfa ensane wo etoso ebio se yehu se chiachia pi no nsam chia no ema yare no ete atese nti nyai ne yentwa so ansa efa niema bia eye amamre ene amanne ye betimi ede ya no ate atese no yentwa so ansa obi ebebo wa anase obe wansi ofa tissue na ofa nkone hene katana no na owia onyan to baabi abasa fakoto baabi a eho ye safe ye de chance bia na se be to baabi a odi atum ya fa akohwu akoto atwene enfa problem bia ma se obi betu kwa omampanyin edi atodwa se yemfa akwantuna no enhia no yenyai akire dinsa na yare no koto ye di ya tusa akwa no odi ko apotokasemu ya se critical travels se akwantuo bi enye critical traveler yenyai na yentwan so yenhwe ema yare no enkoto ansa na yare no ekoto akire no obeye bibia wa akoye am se metimi aka ewo to fanbo ewo atwi mu no medamase.
Yeah. Thank you very much. I also want to ask something about the best and the bus terminals and transports area, because it's an important route because people get out of the plane, they will travel by VIP, STC, etc. So it's very important. We've engaged them and we asked them that they should take information at a minimum, name, telephone number, name of a next of kin and the number of the next of kin, so that should we need to do contact tracing for anybody, we are able to reach them, and they are all cooperating with that. There was also the issue of the disabled. The risk communication is already going to meet one of the groups. A lot of the material will be translated into Braille and other things so that we can also reach. So there's a lot of activity on that area. I'm sure when it comes to the tree, Honorable Minister is excellent, so he'll do all that. Thank you.
Let me repeat the website address as we wrap. GhanaHealthService.org/COVID-19 GhanaHealthService.org/COVID-19 / The travel advisory, I'll quickly get in Chi. Edikai Abain Ebo de Ruse, Sampen Pensuya away. Yes, say a whom he pass over Bagana Babi Bibia. Member. The Tosumienu Obibia or Bagana. I just said, or ye Ghana ni ba anase Ghanaian citizen. And also be a Ghana buying a man permit say or tina Ghana ye. I just say uncle for me with dia. Ubi a person or Bagana and na edu enaya da yentemi ababisi da person or Bagana no. Wako oimbia sayare no ebi wo ho a nipa be ya henu enye bi. Ya ma kwan ma unwura Ghana ha sei. Ne ewiemuhyen adwuma eku edi nkomo se wono yemma womfo plane no ewo babia wopese wo fokora ebi osu ye ne ye border posts mpanimfo immigration ne national security for also edi nkita ho se omo behwe se wono so yemma wonwura Ghana ha sei se obi a sa restrictions we in count na chese wo ye Ghana ni ba na se wo permit se wotena Ghana de a eno de ubedu a ena edu na edikan no they are protocol me friend mandate 14 days self quarantine one kasa obebo hu adwa wo edem a aban panimfo behwe so se adwa abo no e koso no eno na ye be hye wo se obeye eho nkrata eni kwan be fa ye no aban bambo adwuma ya friend national security any health authorities omo hwe na omo de aye adwuma sene obi bia ono de owa kwanya se oba Ghana under new guidelines no ono so oba sa self quarantine obetumi ediso obetumi abo no ho adwa aban panimfo behwe so obi a yesese ne yehu se ono ankasa bo no ho adwa dum pempen so a yehwe a enye yie the apotoka se friend no satisfactory self quarantine enye yie no eno ne de aban ebebo no adwa na se yebe put no into quarantine apart from we mu no obi biara ho a yedikan esese ewo ye port sene say ye no ne ehwe na se wo nipadua no kire se sa yare asa wo nya bia eno no de aban mpanifo bema yedikan bo adwa ho a na ya teste se ebi wo mu ana se ebi no mu de yedikan se wo ni bibia huhia pa se oba be Ghana emma no no de sabre ya ye kase ya ye de yedwuma ne kai na amaka no banada ebo donko pe a na afiase eye adwuma san se wo se man ho beye enamienu a security for ne port health for ne ade so ebebobo ho e de aye adwuma na obi bia so ebi opese osesa na kwantu anase onji ne travel protocols no so anya akwanya. Colleagues, we'll be drawing down the curtain on our briefing this Sunday afternoon. As I mentioned, the web page is available for regular updates. We very much appreciate the work that you are doing in the media. We implore you to desist from the speculation and let's stick to the official data that we are putting so that we don't cause a lot more panic out there. We are asking everybody to help us spread calm and not fear. The way to spread calm is to share the preventive etiquette that has been articulated over and over again. Don't stop talking about it on media platforms without making a note to share the preventive etiquette. When we are done, the Honorable Deputy Minister for Health and their colleagues here will join me to receive a donation, I understand, from Dettol of hand washing products that they believe can also help in the public education. Dettol, we are very grateful to you, and for other private organizations that also at the time of national need want to help the exercise, you are welcome to come on board and to support us. Everything that we are doing is spearheaded by an interministerial committee that has education, national security, local government, health, finance, information, interior, all on board. We thank all of these agencies that are working, including the health workers at the various clinics and isolation units and treatment centers. We thank them very much for their sacrifice and their hard work. We thank you for attending upon our invitation this afternoon. May I ask the colleagues up here and the dignitary join us through the Minister's exit as we receive the donation from Dettol. And colleagues in the media, you can please capture that donation from Dettol as well. Thank you very much.